Hi there. Welcome back to my clinic. How are you today? I see. Oh no. I'm so sorry to hear that. So, did the fall happen yesterday? What time? Okay. Was it late at night, dark, AC outside? Yeah, now that it's winter, it's true. I see that a lot of my patients are getting into falls, which is unfortunate. Now, how did you fall? Oh, backwards? Did you hit your head as well? Oh, I'm so sorry. How is your head feeling right now? A little bit achy. Okay. I can definitely take a look at that for you and make sure that I'm doing all the physical exams that pertain to a fall that involves a head trauma. Okay? Alright. Otherwise, how are you feeling? A little bit scared. That's understandable. I assure you, I will use all the skills at my disposal to make you feel better and to assess whether there's any severe consequences of your fall. Okay? But just by looking at you on general inspection, I don't see that you don't seem to be confused. You don't seem to have any slurred speech or any delay in answering my questions. So those are all very good signs. Exactly. Now, I'm just going to ask you a few more questions, okay? Have you had any headaches since the fall? No headaches? Good. Have you had any amnesia, any memory loss pertaining to the fall? No? That's good. Have you had any dizziness? No? Good. Have you had any ringing in the ears? Okay. And finally, any nausea or vomiting? No nausea or vomiting. Have you had any fatigue at all? No fatigue. But a little sleepiness, I see. How have you been sleeping? Not very well. I'm so sorry. When it comes to event that causes trauma, that can definitely happen. Has it been on your mind a lot? Yeah. I see. You're worried about the results of the exam. Well, so far, looks like things are okay. Nothing too serious that I have observed, but I will have to do some measurements of your skull, and I will have to do some palpation. I would also like to look at the rest of your skin to assess if there's any bruises or any kind of wounds. Okay? I also want to do a comprehensive cranial nerve exam. Okay? Because I definitely want to see if there's been any trauma to the nerves within the skull. Yeah, these are all important things. So I'm going to start off with just measuring you. Okay. So here's my measuring tape. Okay. So I'm just going to take your circumference, if that's okay with you. Okay. then I'm just going to come to the side. Okay. I'm just looking for any asymmetry in your skull, which can tell me a lot about whether there's any inflammation, any edema, anything like that. Okay. Okay. Next, I would like to palpate your skull. So I do have to kind of work with your hair and just part it in different ways, okay? Alright. I'm just going to start from up here, actually. And okay. Is there any pain or tenderness here? No? Okay. Just notice a little bit of a bump. Just going to come to your side. And this side looks just fine. Is that okay for you? Okay. And come to your back. Is that okay? Yeah, I see a little bit of a bump back here as well. Is that painful? A little bit achy. Okay. And then onto your other side. Just going to come over here. Okay. Very good. Alright. I do also want to inspect your skin. Okay. So I'm just going to take a look at your arms here. I'm just going to pull up the sleeve a little bit of your gown. Okay. So don't see any signs of bruises. Very good. And come over on this other side. Again, I'm just going to pull up your sleeves a little bit. Take a look at your skin. Okay, no signs of bruises here. And I'm just going to come down to the bottom. And again, there's a little bruise over here, but did you have that before? Okay, that's good. So, on this side here. Okay, good. I'm just going to come and look at your back as well. Okay, I'm just going to undo your gown if you don't mind, slightly. And just look at... Okay. So as far as I can see, everything looks good. Okay, so next I am going to do your vitals. Alright. Just taking a little thermometer cover and for your safety, which is our utmost priority. Just gonna have you put that under your tongue. Close your mouth. Okay, good. Okay. Alright. So in Celsius, you have a temperature of 36.5. No signs of fever, infection. No sign of sepsis or anything like that. Okay. going to take your blood pressure, if that's okay. Just going to put it around your arm here. Okay. I'm just going to pump up the cup. Okay. Can you please raise your hand and then pump your fist 10 times for me? Okay. Thank you. Okay. You can just relax your arm against mine, okay? Your blood pressure looks good, 120/80, which is a perfect blood pressure. It also shows that you don't have white coat hypertension. Next, I'm just going to take your pulse and your respiration rate, okay? Just going to come up a bit closer and take a look at my watch here. Okay, your pulse is 65 beats per minute, which is a very good sign. And I'm just going to look at your respiration rate. So just breathe normally. Okay, 16 breaths per minute. Perfect. Okay, so now I'm going to be doing your cranial nerve exam. Have you had that done before? Many times? I see. Have you been in a lot of falls before? I see. Okay. So with a cranial nerve exam, we have 12 cranial nerves. And do you want to know what they are? Okay. There's actually a memory device that I still use to this day, even with so many years in practice. This is how it goes. Ooh, ooh, ooh. To touch and feel very good velvet. Such heaven. And that kind of outlines the first letter of each of the cranial nerves. Okay, so I'm actually going to be following along with that memory device as I go. Alright, so the first is olfactory, which is your sense of smell. Okay. So for this one, I have a few essential oils. I'm not going to show you what they are. I'd like for you to tell me, based on your sense of smell, what the essential oils are. Okay. Let's start with this one. What do you think? Grapefruit. Exactly. Next. Minty, yep. Peppermint, exactly. It's probably one of my favorite scents. Yours too? Great. The last one. I'm not sure if you would know this. It's a little bit more obscure, but it seems like you do have a good sense of smell, so maybe you would figure it out. Eucalyptus. Exactly. So your olfactory nerve is working perfectly. Next, we're going to assess your optic nerve, okay? Are you familiar with this chart? It's known as a Snellen chart, okay? I'm going to have you cover up this eye for me. Okay. And I would like for you to read the lowest line that you can read clearly. Which line is it? This one here? Okay, go ahead. No. 3, yep. 7, 8, 2, 6. And you can point to the direction. Downward, yep, good. So, good, very, very good. Okay, now I want you to switch the other eye, cover this one. And this time I want you to read the same line, but backwards. Okay? Directions, yeah. Good. Yes, very, very good. The reason why I do it backwards is because some people have really, really good memory, and they might be able to just recall their memory and say the right numbers, which do you have good memory? Fairly good memory. Next, I would like to look into your eyes and check for your pupillary constriction. Is that okay? So I'm just going to put a little divider between your eyes and look at your direct response. Good. Direct response on this side. Good. And then your consensual response, so I'm going to shine it on this side and look on this side. Good. Other way. Very good. So your pupillary constriction is working perfectly, direct and consensual. So that involves the optic nerve and the oculomotor nerve. So that's all working perfectly. I also want to do a peripheral visual fields test. So in this one, I'm just going to step back a little bit. I'm going to have you let me know when you see the wiggling tips of my fingers, okay? And you're going to close your eye, this side, same one as me, and look into this one, okay? Let me know when you see the fingertips. Good. Let's try that one again. Good. 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 Very good. Now I'd like for you to cover this eye over here. Good. So your peripheral visual fields are intact as well. I don't suspect any lesions of your optic nerve, optic tract, optic chiasm. I don't suspect any glaucoma or any compression of your optic nerve either. So here's my panoptic ophthalmoscope. You remember this? Okay. And I'm just going to be, is that too bright? No, that's okay. I'm just going to be looking into each of your eyes. I'm looking at your optic disc. Okay. So I'm going to start with this eye over here. So, the optic disc looks perfectly, a clear outline, no bulging, nice golden yellow color. Very good. Cup to disc ratios are 2.5 as well. Okay, let's look over at your other eye. I'm going to come right up close again. Look at that optic disc. I'm also looking for any pallor, which might suggest atrophy. I don't see that. I don't see any blurring, bulging. Your arteries and veins are also converging nicely. Good size. Okay. Beautiful. Beautiful eyes, truly, inside and out. Okay. So I've finished examining your optic nerve. Next I'm going to move on to your oculomotor, trochlear, and obducens. Okay. So, I'm going to have you look at my light, okay, and don't move your head, just move your eyes, alright. Just going to take your nice and slow, good, and at the ends I'm just looking to see if there's any signs of nystagmus, just involuntary kind of shifting of the eye, which I don't see. Very good. Let me know if you have any double vision at all. Okay? Don't move your head. Okay? Come back. And down. Very good. Okay. Looks good. So it looks like your oculomotor, trochlear, and abducens nerves are working just fine. I do also want to do another test for the oculomotor nerve, which is the ear reaction and convergence test. So for this test, I want you to, do you see that lovely lady over there? So I want you to look at her and then back at my pen. Okay? And look back at her and then back at my pen and back at her lovely face and back at the pen. Now I'm just going to bring the pen closer to you. Good, very good. So I was able to see, the constriction, the accommodation of your lens. And I was also able to see the convergence. So all of that is intact, working perfectly. for the next part, I do have to put on some gloves. Are you okay with latex gloves? Good. I'm glad that you're feeling better. Yeah. So far, so good. Nothing to worry about. Okay. Are you feeling relaxed? Out. Can I get you anything? Okay. So, what I'm going to have you do is clench your teeth. I'm just going to be feeling for the masseter muscles. So just go ahead and clench. And release. Clench. And very good, very strong muscles. And then your temporalis. Clench. And release. Clench. And release. Very good. They're working perfectly. Next, I want you to drop your jaw like that. Just feeling for your lateral pterygoids. And then move your jaw from side to side. Very good. Perfect. Here's a little cotton swab. I want you to let me know if you feel pain, sharp sensation, or dull sensation. Okay. Please close your eyes and point to where you feel it and whether it's sharp or dull. 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 That's right. Sharp. Sharp. Good. Dull. Very good. Dull. Sharp. Dull. Good. Okay. So it looks like our dull and sharp differentiation sensation are intact. I do want to also check for light touch sensation. So we're just going to use a cotton swab. This is how it's going to feel like, okay? Like that. So I want you to close your eyes again and point at where you feel the sensation. Good. 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 Very good. And good. Next, I'm going to test for your jaw reflex. So I'm using a reflex hammer. I'm just tapping onto your chin like this. I'm just looking for the movement of the jaw and making sure that it's not too prominent. Okay? So I'm just going to looks good. Just a slight reflex of the jaw, not too much, which can suggest a lesion in the upper motor neuron. So you're perfectly fine in that aspect. So I'm done with the trigeminal nerve. I'm going to move on to a nerve that's really quite fun. It's called the facial nerve. And for this one, we're going to be doing a taste test. How does that sound? Okay, please close your eyes. Alright? And plug your nose, because we don't want your olfactory sensation to be involved in here. open up your mouth and stick out your tongue. Good. How does that taste like? Sweet. You can open up your eyes now. Yeah. Rock candy. Which, I'm Central Asian and we call it Noa. It's often used to make the tea sweeter. So we would just stick it right into our tea and then like swish it around like that. It's actually quite fun. Little kids love to use it as well. So you got that taste. Okay, please close your eyes again. Plug your nose. Open up your mouth, stick out your tongue. Are you okay? You can go ahead and open up your eyes. Yes, it is a lemon. And I saw how you kind of wrinkled your nose there. I know, it's quite sour. You got that one? Perfect. Perfect. So, facial nerve, taste sensations intact, but I also need to test your motor your motor function. Okay? So I'd like for you to raise your eyebrows. Good. I'd like for you to shut your eyes closed so tight that I wouldn't be able to open them. Very good muscle function. Next, I'd like for you to frown. Good. Smile for me. Yeah. Now, show all your teeth. Yes. Good. And puff out your cheeks. Good. Very good. So, your facial nerves, motor, and sensory function are all intact. That's very good. Sensory and motor intact. Here's my otoscope. Okay. I want to take a look into your ear really quickly, if that's okay. It's not normally part of the cranial nerve exam. Basically, I'm moving on to the vestibular cochlear exam, and I would do the check for your hearing, but I also wanted to just look into your ears just in case. That's okay. It's going to come on this side. And just going to go a little deeper and see if there's any, inflammation or perforations of your tympanic membrane. Any signs of infection. Okay. Any discharge. No, looks perfectly clear. Translucent tympanic membrane. No signs of inflammation. Great. Come on to your other side. And take a look in here as well. Okay. Let me know if there's any discomfort at all. Okay. Just a little bit of serum in this one. Definitely see a little bit of inflammation, but not a lot. No perforations in the tympanic membrane. No. Yeah, I don't see any obstructions or ears look great. So let's proceed to your hearing test. All right. I'm going to start off just covering the side of your ear. Okay. And I'm just going to whisper a few numbers on the other side. 1, 2, 3. 1, 2, 3. Good. Now I'm going to cover your other side. 10, 7, 6. 10, 7, 6. Very good. Are you familiar with the Weeper and Renee test? Okay. So you could let me know which ear you heard it first. Good, good. Heard it both ears. And then I'm going to do the Renee portion. Come to your side. Try that again. Do you hear it? Good. Let me know when you stop hearing it. Stop hearing it? Okay. Do you hear it now? You're good. Let me know when you stop hearing it. Other side. Do you hear it? Good. Let me know when you stop hearing it. Hear it? Good. Let me know when you stop hearing it. Very good. So there's also the vestibular portion of your vestibular cochlear nerve, but I'm actually going to assess that a little bit later, okay? Next, I'm going to assess your glossopharyngeal nerve with your vagus nerve together, okay? Go ahead and open up your mouth, okay? Yeah, so I am testing your gag reflex. Is that okay? Alright. Open up your mouth. Good. Just slightly irritating it. Just a tiny little bit of a gag reflex. Just making sure that glossopharyngeal nerve and vagus nerve are working well in that aspect. Next, I want you to say ah. Good. Just depressing your tongue and looking at the uvula. Make sure it's midline. Symmetrical rise of your palate. Very, very good. Okay. And I don't hear any hoarseness of your voice, which suggests to me that you don't have any, laryngeal nerve, which is a branch of the vagus nerve. Any issues there? Very good. Okay. And no nasal quality either. Good. And I wanted to the hypoglossal nerve first, and then we'll go back to the spinal accessory. Okay? So please stick out your tongue for me. Okay. I don't see any atrophy or fasciculations. Can you move it from side to side? Good. Very good. Move it up and down. And stick it out fully. Very good. So motor function of the hypoglossal nerve is intact. Very well intact, in fact. And finally, I'm going to assess your spinal accessory nerve. Okay? So that innervates your traps and your sternocleidomastoid. So I'm going to put my hand on either side of your face, and you're just going to push your face into my hand as strong as you can. Okay, this side, push, 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 push. Good. And the other side, push, 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 push. Very good. Okay. I'm just going to come to your back and assess your traps. I'm just going to undo your gown a little bit again. And I'm just going to see if there's any signs of atrophy or fasciculations, which I don't see. Now I'd like for you to push your traps into my hands as hard as you can. Push, 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 and release. Very, very good. Very good. Okay. And that concludes your cranial nerve exam. How do you feel about it? You feel relaxed? I'm glad that I was able to provide a relaxing experience for you. I do really appreciate that you came in as early as you did after your fall. Okay? And are you feeling at ease now? Good. So, like I said, there's nothing to worry about at the moment, that there were any severe consequences of your fall. You can put an ice pack on the little bump on your head, okay, up here on the back as well. Yeah, because that can help to reduce the swelling a little bit. And if you experience any symptoms out of the ordinary, I want you to call us right away, okay? And if you even just want to talk to me, ask any questions, please don't hesitate to call me. I'm here for you, and I'm here to help you feel better, okay? So thanks so much for coming in. I'm just going to be finishing up my notes, and would you like to stay here? Sure. You're absolutely more than welcome to stay here. In fact, I do see that you're getting a little sleepy. Since you didn't sleep well last night, I want to make sure that you're sleeping well tonight. So you can go ahead and get a head start, take a nap. Okay. I'll just be working on my notes in the back.